All right. Welcome to this very historic day. Today is the inaugural Black Maternal and Environmental Health Day. It's been a long time coming. My name is Latricia Adams. I am the founder, CEO, and president of Young, Gifted, and Green. You may have known us as Black Millennials for Flint, but we have since expanded our vision and work and excited today to talk about two very important aspects, particularly of the Black woman and Black childbirthing experience, the intersection of Black maternal health and environmental justice. Far too often, when we talk about the holistic health of Black women and Black childbirthing people, we don't think about those external factors that play such a pivotal role in the birthing experience. So tonight we have a jam-packed panel of some experts that will be able to speak to that connection. Before we get into introductions of this phenomenal panel, we want to acknowledge all of the people, all of the mayors that actually acknowledged Black Maternal and Environmental Health Day. We're so excited that we had 7 cities that actually did a proclamation, and we just found out that none other than the state of Michigan is the first state to proclaim Black Maternal and Environmental Health Day. Super excited about that. We know that as time progresses, that it's going to grow further and further. And the biggest thing is that we really want to make sure that more people are knowledgeable and able to really make those connections as it relates to Black maternal health and environmental justice. So with that, let's go ahead and get started. So we're going to do a very brief whip around just with some introductions, and we can keep it brief because these sisters are phenomenal, and I can go on all day about how fabulous everybody is on this panel. So just starting with some introductions, if we could start with Anna, just tell us a little bit about yourself, and then we'll go next to our next speaker.
Greetings, everyone. My name is Anna Rodney. I am the founder and executive director of Mom Cares. Mom Cares is an organization that supports Black women who are navigating high-risk pregnancies and or NICU involvements after a traumatic birth outcome. We do a lot of education around the maternal health crisis, direct service, community education, and advocacy. I also serve as the Baltimore City chair for the Maternal Mortality Review Board, and I also am representing Baltimore City as a women's commissioner. I'm happy to be here.
Look, we starting out powerful. All of those, put some respect on Anna Rodney's name. I love to see it. All right, Almeda Cooper.
Hello, everyone. My name is Almeda Cooper. I'm the National Manager for Health Equity with Moms Clean Air Force. It's a national organization of about 1.5 million moms, dads, and caregivers, and we're focused on clean air and children's health. And I, in the second chapter of my life, so in my previous life, I was a general counsel at a healthcare organization, so I have a long relationship with healthcare.
Awesome. And always such a fan of you, Almeda, and Moms Clean Air Force. Listen, these mamas are not playing when it comes to this environment and protecting our babies. All right, Dr. James Todd.
Good evening, everyone. Latricia, thank you for bringing us all together. This is terrific. My name is Tamara James Todd. I am an associate professor at Harvard Chan School of Public Health, where I direct the Environmental Reproductive Justice Lab. As an epidemiologist, I look at the role of environmental and consumer product chemicals as it relates to reproductive health, specifically looking at that in those products that are marketed to Black women and how that can contribute to health disparities. Again, thank you so much for having me today.
Yes, I would be remiss not to say how much we reference your body of knowledge in this work. When we talk about later, just like policy and things we need folks to do from a political advocacy perspective, your voice is so integral in that work. So thank you. Um, moving to LaPrisha Daniel.
Good evening, all. So happy to be sharing this space with you all. I'm LaPrisha Berry Daniels. I am the Executive Director of Detroiters Working for Environmental Justice. Detroiters Working for Environmental Justice was the first environmental justice organization established in the state of Michigan. This is our 30-year anniversary. Um, I am trained as a public health social worker. Actually used to work in the health system as a medical social worker many moons ago. But right now, leading this work in Detroit focused on reducing environmental health disparities and doing that with the voice of the community at the center. So we work to amplify the voice of the community as decisions are being made that impact their health and well-being.
Yes, so it's a lot of celebrations in the house. We have to always give honor to Detroit. Just from the foundation of the civil rights movement to the EJ movement. Just so excited to have you in this space. And last but absolutely certainly not least is Audra Jones.
Thank you so much. I want to thank Young, Gifted, and Green for inviting me. I'm also grateful to be on this panel with such esteemed leaders in the community and doing great work locally and across our nation, because the work that you do will expand for others as well. But my name is Audra Jones. I'm the director of the African American Infant and Maternal Mortality Prevention Initiative in LA County with the Department of Public Health. Within our maternal, child, and adolescent health programs. This is the first ever in our county. This came to be in about 2018 as I had the vision for creating a 50-50 partnership between community and government to address the high rates of African American infant and maternal mortality in our county. And we have done such great work since this has happened, especially expansion of the Black birth worker force, as well as looking at collaborations with community partners and leaders that are doing the work. So that's my day job. In my spare time, I volunteer with Black Women for Wellness, who's done great work around environmental health and maternal and infant health for Black women in our county, and so much more throughout our state. So excited to be here and looking forward to this great conversation with you all. Thank you.
Yes, anything that talks about environment, we are always looking at California, both in the birth worker space as well as environment, has informed so many folks. I'm a native of Memphis, so in Tennessee, not as progressive as California, but borrow so many things to make the environment better for everyone. So let's go ahead and get this panel started. So with environmental justice issues, unfortunately, they really manifest themselves in predominantly Black communities, also Latinx and Indigenous communities, but more pronounced as it relates to Black communities, and it hits Black women, Black childbirthing people extremely hard. So whether it be from proximity to waste facilities, whether it be food deserts or food insecurity, air pollution, I mean, a litany of different things that impact pregnancy. So starting with Anna, why is it so important that we really, for the first time, y'all, for the first time, we have this Black Maternal and Environmental Health Day. Why is it so important to have awareness with a day like this?
Absolutely. I think when we talk about issues, we tend to silo ourselves unintentionally. But when you're even thinking about the social determinants of health, environmentalism is a part of that. If you do not have access to green space, clean air, we have a model that recognizes that that can impact your health. And so we really need to make sure that while we're working to correct the crisis of maternal health and infant health in our Black communities and Brown communities, we really need to take a holistic view and understand that the process of giving birth, of gestating that baby, of even preparing your body to be able to give birth is influenced by your environment, by the food you have access to, by your stress levels. We're seeing that these comorbidities, existing conditions are being exacerbated by our environment and exacerbated by the lives that we're living even before we get pregnant. And they're being elevated by the pregnancy. And so what we need to understand is it's not a either or, it's a both and as far as how we are looking at this issue, if we are really being serious about making sure that we are correcting the crisis in a generation, right? We know that our care is important. We know that our food is important. And so we need to make sure that all of the things that are interacting with that mama, interacting with that family, interacting with that unit, mom and partner, are doing so in uplifting them and supporting them and not detracting from their lives and not detracting from their quality of life so that we can produce healthier, stronger, happier families and babies.
Yeah, and that
Patricia,
really resonated with me. Oh, go ahead.
may,
Yes.
may I just jump in and add one thing that I think complements what was just said? And I just want to emphasize that one of the most basic hurdles that we have when we're trying to emphasize Black maternal and environmental health is just to get the general public to understand, and health professionals, that there is a human connection between health and climate. And unfortunately, many of our health professionals were not trained to make that connection. And while they may be in a particular geographic location where, say, for example, there are wildfires, where people may make that connection because it's present and it's such an acute situation, there are so many aspects of pollution and environmental hazards that impact particularly pregnant women and others like children, young children and people over 65 years of age and older that are really tied to health and climate. So I just wanted to reemphasize that, and also to say that we've kind of passed the period when people were not aware of the climate crisis. And the two Yale Climate Communication Center and the George Mason University Climate Communication Center have done surveys and studies that show that people know that there's a climate crisis. And finally, what we're seeing in those surveys is that they're starting to understand that there is a connection, with other issues related to climate, but most importantly, that people are not talking about it. And that's why this conversation is so wonderful, that's the predecessor to getting people to talk about it, so then they can translate into taking action.
You spoke a word and something that's really important, and I talk about this a lot. There's a difference between environmentalism and environmental justice. And that's not to disparage one or the other, but oftentimes when you have, and I'll just be frank, when you have a white audience, right? Sometimes there's a disconnect between when we talk about environmental justice, people are at the core. So we're not just talking about the environment for environment's sake, but it's how we are interacting with the environment, and then what we do, what we put into the environment, and sometimes it's not even us, okay, that are putting said things into the environment, how the environment responds back to us. So thank you for uplifting that. I think a lot of times, in certain spaces, in the environmental movement, it is largely white, male dominated. And so it's important that we have conversations, as you mentioned, like this. But before we transition, did anyone else want to provide a bit more context around why this day is so indeed important?
So I'd love to jump in if it's okay, because I want to be clear that I really appreciate both of the other panelists on this, because it's a really important and valid point about the fact that it's, the community, people at large don't really have a great sense, and even how we define environment becomes really kind of difficult to interpret. And so I often talk about, Do you think about where you live, work, and play? So the air you breathe, the water you drink, the food you eat and what's in the food, all of those different things, the products you use on your body, the toothpaste you may have used this morning, the deodorant that you may have used this morning, the hair products you may have used this morning, all of those things, and how it's really an intersection of many, many chemicals. So the average woman is, using, about 12 products a day, maybe more. And that means that they're exposed to hundreds of different chemicals that many people think are safe and okay, because, they suspect that our country uses regulatory policies that test these things. Or, the average person, if you ask them, we just did a study where we were looking at, do people think the water they drink is safe? The tap water that comes out, or the bottled water that you're drinking, or the filtered water that you're drinking, is it safe? And, in our study, half of the people weren't sure, or they didn't think it was safe. There's a lot of conversations around lead service lines these days, and most people don't know if their home has a lead service line and if that's, safe at all. We talk a lot about outdoor air pollution, but what's happening inside your home? Did you know that gas stoves are the main and primary polluters in your home, so that you're exposing yourself to all sorts of particulate matter? And so, when you kind of take it bit by bit, and you recognize that, Black individuals are more likely to live near Superfund sites, near landfills, be exposed to harmful chemicals in hair products, live in communities that are more polluted. It's exhausting to hear that and not see actual solution. And Latrice, I think this goes back to the environmental justice piece. I don't know about y'all, but I am tired of hearing about the disparities, and I want to see action. And so one of the ways in which we're doing that is recognizing that healthcare professionals are not only important health communicators, but they are also important advocates. And yet medical school, nursing school does not have environmental health as a part of the training. So what if we improve that? What if we actually built in mechanisms and opportunities to improve environmental health literacy? And we're doing that work through a number of research studies, and also engaging with doulas, because they are key healthcare providers and professionals that really serve as advocates. And we are finding ways in which we can, through narrative-based storytelling and using environmental health information, that we can actually improve knowledge and awareness within these healthcare professionals, that then can translate to improving health in pregnant and birthing people.
Yes, Dr. James Todd, you brought that all the way together. And when you talk about the transition to gas, to electric from gas, that's a culture shift too. Another conversation, but that's mind blowing. Like, I think about my grandmothers, rest their souls. Man, if they only knew, right? Like, it is, thank you for uplifting that. That's a whole nother conversation for another day, but it is so important to think about like how these environmental factors literally show up in our every day-to-day activities. Like you mentioned, like the hair products that we are using, that are targeted towards Black women, Black childbirthing people. So thank you for uplifting that. Do want to honor if Audra wanted to share on that question as well.
Well, thank you for that. And Dr. James Todd wrapped it up. I believe it was shared by all. But here's the other caveat is that I think what we experienced during the pandemic was the ability to look at ways in which we could shift the way in which we prepared our food, what food we had available, if we would start to garden on our own, looking at ways to identify what's toxic. I recently, probably within the last month, learned about the Yucca app. And what I like about that app is that it works for, food and some of those items, right? So especially our hair products. So, I'm big on get my hair done, have, my grandmother and grandfather owned a beauty shop. And so I, grew up in that environment. And they, had these cosmetology huge events that they would have every year, and we'd go to. And back then, folks was getting jerry curls and all types of chemicals that are being added, into it. And it's still the same with perms. Like we're hearing and seeing about if you have fibroids and you used the perm product, then you need to check into seeing if that is the cause of your fibroids, and you may have a lawsuit, right? But before we get to that, thankfully these apps are being created that not only share why the product is toxic, but here are your alternatives. So it's surprising, like you said, they're marketed for Black folks. They'll have a young Black woman on the cover. They'll have, oh, this is for this oil or whatever, is for those who are doing natural hair, right? So you might be wearing your fro or your braids. Well, you look into it, it's like, oh my God, all of these chemicals are in here. Okay, how do I learn how to create my own products or use alternate products that will still work well for me? And so I think that's one of the things that is helpful. The other is, the food deserts that we suffer from, and having, opportunities to either look at ways that we find co-ops to help for those who may not have enough resources. What will we do in having a crisis response? And we could talk about this a little bit more as we go down, in the event of something like what happened with the pandemic or bad storms and weathers, which would prevent folks from getting to the services, to the stores and things that they need. Even though, we have delivery options, that may not always be what is available.
Yeah, thank you for that. And to wrap up this question, Lucretia, if you have something to add to that as
Sure.
well.
It's hard to add after everyone else has spoken so eloquently about the topic. But the thing that comes to mind, and I think part of what Dr. James Todd said in terms of action, right? We're sick of naming and labeling and just counting, right? What's happening. And a lot of times when we have these types of days or observances can get washed out or watered down, like what the Easter Bunny did and what the Christmas tree did to Christian holidays, right? We wind up getting caught up in the social media posts. We wind up getting caught up in the color you're supposed to wear, and we sort of forget about the action pieces that go along with that. So I'm hoping that this will be the first of many times that we're able to reflect, days of reflection and action. And in particular, I think about, you brought up first that these silos and the importance of looking at these things together and making sure that, for two reasons. One is looking at the systems, right, that contribute in different ways to both of these issues. And then being able to sort of combine forces, right? Folks that are interested in environmental health and environmental justice with those that are focused on birthing justice, right? And so that we can have this more power behind the movement when we can see that intersectionality. And so really excited to be part of this panel, to start having some of those discussions about action, hopefully at some point. I lead an organization that's focused on environmental justice, and for us, that means action. So really happy to have this conversation, and hopefully it's spurring things in folks' spirit so that we can start thinking about how do we combine forces to make sure that our collective agenda is moving forward.
Thank you. And that's actually a perfect segue. So you say like systems, this stuff is on purpose. Okay. When we think about the existence of white supremacy, systemic oppression, it's not happenstance that, when we talk about these overburdened communities, that they are largely Black. When we talk about like Black women being the most at risk as it relates to pregnancy, the most impacted when we talk about climate change, we can't say that it's just a fluke. It's not. It's not. It is truly by design. And so, the numbers don't lie. So, Black women are 3 times more likely to die from pregnant-related complications than white women. Let me say that one more time. 3 times more likely to die. So, when we think about this, and starting with Almeda, how does environmental racism play a part in Black maternal health issues?
Well, one of the things I like to start with is a definition. And Dr. Bullard, the father of environmental justice, many people consider him to be, One of his definition is that it's any environmental racism is any policy, practice, or directive that disproportionately harms people of color. And a simple way to say that is environmental racism is any action that disproportionately harms people of color. Sometimes people kind of get caught up in the words, but that's a kind of a simple definition. And then when I started thinking about it in preparation for this conversation, I started thinking about, and when you're talking about policies, directives, and practices, you have to think about who makes the decision. Who are the decision makers in this country? Who are the primary people who get to make decisions that have impact Black women and anybody who falls in the category of being disproportionately harmed by environmental hazards. So here's some just information that really made me start thinking. 3% of the US population are millionaires. 50% of the US population would be categorized as blue-collar workers. And then if you think about the US Congress, which is our major policy, national policy decision-making body, that less than 2% of congressional members have ever had any kind of blue collar job or had a blue collar job before they joined Congress. There's no record of any person becoming the president of the United States or a member of the US Supreme Court who was a blue collar worker. And then if you look at the current composition of Congress, about 90% of congressional members, senators and congresspeople, are white. 96% of all US governors are white. So one of the things that we know, and we particularly know it in healthcare, that you have to have someone who's culturally competent to help people make healthcare decisions. And if you have this composition of people who are making decisions in general for us in the United States, then it's kind of easy to see why the decisions or the outcomes that we are seeing do not take into consideration this disproportionate harm that we are so clearly aware of. And one other thing I would like to say too is that when we talk about environmental racism and environmental justice, I just want to emphasize that it's not a simple one size fits all. It's a very complex issue. One person mentioned, the social determinants of health. Those are many issues, but all of them are related. And we have to constantly make people aware that even when there's a lot of research done, and now we're starting to see more research done, because for years, Dr. James Todd probably knows this better, is that when research was being done about health impacts, they were done on men and women. Like people always say, children are not little, adults. Women are not shorter men. And so if you're not doing research that relates to the impact of a pregnant woman, then you're not going to get as accurate results. And it's not going to be just race. It's not going to be just income. It's going to be a complex, layered, nuanced set of issues that impact on those decisions and that impact environmental racism.
And what you just named there is coined by another phenomenal sister, Kimberly Crenshaw, around intersectionality, right?
Mm-hmm.
So all of these things are interconnected. And if we truly want to get to all justice as a whole, then we can't talk about these things. We can't even work in a movement that's disparate. It has to be all interconnected, because that's how we're being impacted, It's complicated, it's nuanced, but we have to do the work. And so I want to turn to Anna and then to Lucretia. I think about the work in Baltimore, where back in 2019 to 2018, COVID messed up my timeline. But I think about the work that we did with Young, Gifted, and Green as it relates to lead paint. Lead paint issues have been pervasive in Baltimore for decades. And while the state of Maryland has some pretty progressive laws that are in place, there's still so many units, so many homes that existed in Baltimore that have lead paint, and that directly impacts mamas and babies. And so again, like from an environmental racism perspective, what do you see as that having an impact on mamas and babies, specifically, in Baltimore? But that story is almost identical when you think about majority Black and brown cities.
Absolutely. I think so. First of all, I just need to piggyback or veggie back on what we were just speaking about, and say that when we're talking about this issue and the marriage between the two issues and the other satellite issues, we have to acknowledge anti-Blackness and the role that it plays in what's happening and what we're seeing, and understand that, again, like Leticia said, this is intentional. Black folks are the original population that there was intentional legislation to terrorize us, to harm us. There was an intentional building of structuralized operations and institutions to cause harm to us. And so while all of our other brothers and sisters who are brown and marginalized with us, we have to acknowledge that we are the base point of, at least we're not them, right? And what that looks like as far as legislation, what that looks like as far as undoing some of these policies, some of these hospital medical policies, housing policies, these things that have been set in place historically to cause harm to us. Right. And so I think that we need, and again, we're talking about lead paint. And again, Baltimore is one of the, you come to Baltimore, you hear about the lead checks, you hear about the lead paint issue. You go into a school and we can't touch the water fountains, and it's no drinking from the water fountains. In 2024, you are walking into a school setting in which you are not allowed to touch the water fountains because of fear of lead contamination. Right? We know what lead does in the body. It can get into your breast milk. It can get into, which can get into your baby, which can affect brain health. It can affect, so there's all of these different health factors that are negating some of the most healthiest outcomes and healthiest things that we could do for our babies. They're still negating from birth. And we don't really understand that. And so we're talking, again, in Baltimore, one of the things you hear about is, oh, that's a lead baby, or that's, they got a lead check or whatever. But there is no price you can put on how the trajectory of one's life is influenced by lead in their system, especially early on. I don't know how it is in other areas of the country, but there is a test that you have to give your baby, no matter where you live in Maryland, in Baltimore specifically, in which you have to get your child lead tested before they can go into daycare, before they can go into the school system. And again, that's wonderful that we're checking it, but how did we get to this point that it's so pervasive that we're just assuming that a large percentage of our population has lead in their system? And that's on purpose. We have to really recognize and understand that was a purposeful thing. Looking at the units and the houses that are still not eligible for lead abatement. Looking at the neighborhoods in which lead was more prevalent, the population. And and I'm going to step off of my soapbox in just a second. I'm sorry. But understanding that this is an intentional attack. And so that we need to be even more intentional with unraveling that and understanding that we need to take these things apart piece by piece so that we can actually build. We say DEI and equity and equality. We throw those words around right now because it's sexy and it's hot, but we really need to understand the role that anti-Blackness played, and understand if we can focus in on undoing those harms, the rest of the population is going to benefit.
Oh, I feel like I need to say church on that one. Okay, drop mic, Anna. But yes, it just it makes you mad. right? Like on top of just like the sheer existence of Black womanhood, and you keep piling things on. And to think like what you mentioned, because that is very near and dear to the hearts of the Young, Gifted, and Green tribe, is around just the amount of ways that you're exposed to these environmental hazards. The fact that like if my baby, once my baby even before my baby gets here, like the baby can be exposed. Once the baby is born, the amount of ways that they could be exposed, like we have to look at this from a holistic view. But I want to turn to Lucretia. So similarly, with Detroit. So Detroit, Black excellence in Detroit. I'm from Memphis, and we, take pride in our few Black cities that we still have left. And, with Detroit really beginning with thriving with the automobile industry, but unfortunately left a lot of pollution, and not a lot of accountability. Air quality issues that exist in Detroit. So from your perspective, how does environmental racism, thinking about it from a lens of Detroit, thinking about it through a lens of pregnancy, what do you see in your community?
Yeah, so I want to go back to what Miss Almeida, and I was raised right, so unless you tell me to call you Almeida, you're Miss Almeida. What she was saying earlier, she offered up a definition for environmental racism. And what I want to point out is the definition for racism specifically. Basically, what racism does is apply value, right? So some folks are valued, and then some folks are devalued. And what we find in the city, when you mentioned our few Black cities, what we find is that it's a population of people that are devalued. It's a population of people that are considered sacrifice people. And so it should be no surprise that your babies are under attack, right? If you're considered sacrifice people. And it should be no surprise that you have these environmental issues if you're considered sacrifice people, because now if you live in that region, then that's a sacrifice zone. So although not surprising, as you said, Latricia, disheartening, right? Overwhelming. And in our space, in terms of environmental justice in Detroit, trying to figure out when you have folks in leadership that do not care about the population, that are more concerned. You mentioned that, Detroit put the world on wheels, right? So government has for a long time been in bed with industry and trying to figure out how to get rid of that horrible incestuous relationship that now is causing us harm and hazard. And so a lot of folks think about Detroit as, oh, this is legacy pollution. No, we have the largest oil refinery in the nation, or maybe second largest, Marathon Oil, in our community. We have still plenty of industry. We have concrete crushers popping up everywhere, right in neighborhoods, right near schools, right near houses. And so when you think about people over profit, we're seeing that, profit over people, we're seeing that all the time. There are these huge infrastructure bills that were signed, and so now we're going to fix the roads. Well, that means we're going to be crushing concrete. Where's that going to happen? It's going to happen in Detroit. It's not going to happen in the suburbs. It's going to happen in Detroit. And so we're constantly, to your point, you're constantly fighting for and fighting against. And what gives me hope is that we've won some of those fights, and we're able now to demonstrate the power that people can have when we recognize that, unfortunately, as much as we are still being involved in policy and advocacy, we recognize that we don't have time, right? We don't have the luxury of waiting for those things to catch up with what our immediate needs are. And we really are building the capacity of community to fight. That we understand how to do shame campaigns. We understand how to get the media out. We understand and really passing that knowledge on and building community's capacity to do that, so that there won't be a 60-year anniversary of DWEJ. And I'll give you an example. We had a concrete crusher that tried to come to Core City neighborhoods. Well, when that was happening, they reached out to Grandmont Rosedale to say, well, how'd you keep the asphalt mixing plant from coming into your community? Grandmont Rosedale told Core City how to do it. So when Schoolcraft Improvement Association had the same problem, Schoolcraft Improvement Association knew to reach out to Core City and Grandmont Rosedale Now you have everybody showing up to the press conference. You have everybody part of the letter writing campaign. You have everybody making public comment. And so we have to use those same strategies. And that's, again, the beauty of looking at this intersectionality. We have to use those lessons learned to say, okay, if it worked there with that, then we can map that on. But we have to be able to talk to each other. Just like those three communities talk to each other and learn from each other, those of us in the environmental justice movement may be talking to folks in the birthing justice movement, right? To make sure that we are applying that power and those processes that we have that have worked to make sure that we can have progress on all fronts. I don't even know if that's the question you asked, Latricia, but that was what was on my heart.
Listen, I am the daughter of missionary Baptist folks from Memphis,
Okay.
and however the spirit moves you. So
Okay.
you said the right thing at the right time. Okay. Yes, but that was the word, you know, and I like the piece of optimism. Okay, like, whoo, this work is often just so heavy. But you know, just the power of the people. And I think that, you know, even though it has taken 30 plus years, right? But even longer than that, you know, really when Martin Luther King went to Memphis for the sanitation worker strike, that was the birth of the movement. But it's important to also uplift, like when people fight back, right? I think I love the part that you put that we still have won some of these battles. We got a lot more to win, but it's important that when we are in these spaces that we got to win these battles for this beautiful baby that we see with Anna. We got to, we have to. So thank you for lifting that up. We're gonna shift gears just a little bit. So I want to bring in another angle to this. So specifically, when we talk about the pregnancy experience, the childbirthing experience, we think about postpartum, for example. We think about postpartum depression, but there's also implications as it relates to climate. Climate definitely has an adverse impact as it relates to both the pregnancy experience and postpartum. So I want to shift gears and start with Adjoa. What advice would you give to women or childbirthing people, specifically Black childbirthing people and Black women, that could potentially be experiencing mental health issues during the pregnancy and child birthing experience?
Get a doula to start.
Mhm.
I'm a super advocate. I mean, before I even became a doula, to support more so to support doulas within the last 4.5 years. Prior to that, I was a perinatal health educator when I first started in this work some 30 years ago, to really date myself. But I think it's important to have advocates, right? I always tell people, no matter where you go in a clinical setting, hospital, or I mean, just wherever you go for services, it's always good to have someone with you, to have someone that can be a listening ear to what you're receiving. Maybe what you're perceiving is different. Maybe you had a host of questions that you wanted to ask and you totally forgot about it. It's always good to have that advocate that is knowledgeable about your situation, right? So, and further, when you talk about mental health and all that we're experiencing, you know, I go back to Brother George Floyd and Breonna Taylor, and I can go back even further than that. That is a part of our environment, a part of our community. When we're losing Black people at the hands of rogue cops, or we're losing Black people, I just say period, especially due to crimes or anything of that nature, it is traumatizing. It's traumatizing to the families experiencing it. It's traumatizing to us as community to hear those things. So that's a part of our environment, and people are trying to navigate that. One of the things we as Black folks need to do is feel comfortable with seeking out mental health support. The issue of why we hadn't is like what many of you have stated, the structures and the policies and systems that were at play that would over criminalize us, would change the narrative of what is being shared. Whereas we knew white folks were getting all the help and the couches availed to them to lay up and tell their story and have someone support them through their challenges and issues. But for us, it's criminal to state that you're having specific thoughts. and not understand that it may not be criminal at all. You might just need medication. You might just need the therapist. You might need someone to talk to walk you through and talk you through these things. And I thank you, Lucretia, for even sharing as a former social worker. These are the things that we're doing in our work, is working with those systems to have conversations around racism and its impact and the trauma of the experience of the descendants of the African slave and what has happened over 400 years here in America to us. And so we work with partners like Maternal Mental Health now that have worked to, in previous times, a lot of their focus, I can admit, and they can admit, was focused on, not Black folks. And so they started to shift when we came up with AIM and started to be more of a partner. Even prior to that, working with organizations like Black Women for Wellness, connecting with California Black Women's Health Project, I Dream for Racial Health Equity, Lady Winona and her team. And so having to work in our communities and talk with people with lived experience and be able to reshape your programs to whereas we even did capacity building trainings for our community and opened it up that there were folks from all over the nation attending because it was virtual. And we had, a nurse on, and then we had also offered to those that are providing services to pregnant moms and their families, and we are inclusive of dads, to be able to talk about and train folks on how to engage with around Black maternal mental health and what that means, Black paternal mental health. And so I think that is one of the things that we really have to address and look at. Even one of a gentleman put in the chat about the risk around epidural versus natural childbirth. A lot of folks don't realize how when your birth plan changes against your desire and your will, that has impacted folks' mental health and their postpartum outcomes. There's so many that are like, I'm not having a baby again after that because my experience with the hospital system was horrible. So a lot of folks have decided to go to natural childbirth or in natural childbirth, I mean, anything I'll just say about epidurals or any medical procedure, there's always a risk, whether it's a low or a high, it's always a risk. So we just have to note that. What we have to do is be informed about what those risks are. Even at home, if you decide to work with a midwife, then you have to know that that person is prepared for emergent situations and what is their plan. And you all have a plan and have folks that can work with you on that. And I'll come back to Brother Mike's question. He's a social worker as well. I know him being a certified doula and midwife. What's the connection? The connection is a partnership, a relationship. The doula is waist up. The midwife can be full body to the reproductive health and wellness of women. And so we have to understand what those roles are and how we all work together to better serve and come out of these issues and not have a nation that has high rates of maternal and infant mortality, especially in the Black community, and knowing racism is the leading cause of that.
Yes, thank you. Thank you so much for sharing that and the power of doulas. So I know I haven't had my baby yet, but we're going to speak it into existence. I know for certain that experience will be with a doula. The way I have been inspired, I got to lift up my sister Anna, one of the first doulas that I got to work with so closely, that takes away that fear. When you work in this space, like you're inundated with like all of this very damning data where it literally makes me terrified to give birth, but we know that's what the oppressor wants. Right. So, I am so encouraged with, having options. Like I think about like my mother and my grandmothers, a lot of them have options. We were from the South, from the deep South, and thinking about how horrific those experiences were. So I'm gonna do that for my ancestors to go back to our ancestral roots, right? And thinking about accessibility to a doula. So I do want to bring in Dr. James Todd. So this data again, statistics state that more than 80% of maternal deaths in the US can be prevented. So we know what to do, right? We're just not doing it. So Dr. James Todd, what are some programs or policies you believe that could be implemented or that even already exists to help lower maternal health death rates?
A great question. So I think that, the other panelists have really spoken about multiple opportunities that we have to engage. I think, Ms. Almeida, you spoke about the need to, I'm starting at the kind of the largest level, at the national level, really being able to move the needle on these conversations, really appreciating what Representative Lauren Underwood has done around really bringing to light these issues. She and others having these discussions on Capitol Hill and really trying to push the needle forward around, what are the changes that we need to have at the national level, having these discussions, at the state level. And really figuring out what are some state level, community level policies that need to change around where and what folks are being exposed to, and where people live, and being able to have resources available. So, and then thinking about, and I don't want to put the onus on the individual, but you all even shared today, and I see in the Q&A section, some resources that we have available to ourselves to be able to be our own advocates. And I think across the board, something that folks don't often think about, and to give an example, as I mentioned at the beginning of the study, consumer product chemicals. And when thinking about consumer product chemicals, I think most folks, oh, there are chemicals, there's chemicals everywhere, we don't need to think about this. Okay, except that in the United States, we don't regulate our chemicals that we put in consumer products the same way as they do in, say, for example, Europe. And so the same company, you name it, same major company is creating safer products for the European market while creating very harmful products here for the US market. So even when you think about something like hair relaxers, which, by the way, there's an ongoing class action lawsuit because people don't think about, when you combine multiple chemicals, it's a chemical reaction. And so boom, voila, you get a new chemical that's a carcinogen, like formaldehyde. Nobody wants to be inhaling formaldehyde. There's also many other chemicals. We have shown in our studies that chemicals that are used to hold fragrance in products like hair oils or perfume, are associated with things like preterm birth, hypertensive disorders of pregnancy, which, by the way, the leading cause of maternal mortality in this country, and the leading cause of that difference that we're seeing is actually attributed to hypertensive disorders in pregnancy or during the period around pregnancy. So cardiovascular related risk factors. And so you're seeing these consumer product chemicals that are linked to things like this, gestational diabetes and obesity, early onset of puberty in kids, things like that, that we know that Black women, Black people are more likely to experience. And what hasn't been done in science as well is trying to understand, why do we see Black women having higher concentrations of these chemicals circulating in their bodies? And what can we do about it? So we've been really looking at the sources of those things and finding that people who use, for example, hair oils on a daily basis have much higher concentrations of these chemicals circulating through their bodies. We see that hair oil use daily is associated with much lower birth weight in the babies, and is associated with earlier preterm birth. And importantly, and this is why I'm linking it back to this policy question about what our regulations are, prior to about a year ago, our regulations around this had not changed since 1938. We introduce thousands of chemicals every year. We do not use a precaution principle. So just, we see and create new chemicals. These industries create new chemicals. They look very similar to other chemicals that other countries have banned. They put them in our products, and there's no precaution. We don't regulate that. We just, until somebody gets sick, and sues the company, oh well. And so our regulations, we've had the modernization of Cosmetics Regulatory Act, or MOCRA, that came in at the end of last year. But even that doesn't require companies to use this precautionary principle. So that has to change. And importantly, neighborhoods and what people sell. Like we purchase our products, people are like, oh, I get everything online. You don't get everything online. I don't know about you, but I don't get my toothpaste online. I go to a local store and I get it. And so, thinking about what's available when you walk into your local store versus a predominantly white or very wealthy community, and how that differs, because even our retailers need to be educated about this and advocate for safer products. So it's really a multi-level approach around regulations. The Food and Drug Administration, the EPA, all, the national level, the local level. Thank you, California, for leading the charge, because companies don't want to make a whole other set of products for California than, for other states. But we really have to push the envelope so that, what's targeted marketing for one group, which is what's happening, Black products that are marketed to Black people have more harmful chemicals in them. And the regulations need to improve around that. So I'll get off my soapbox, but I just wanted to make that point. Latricia, thank you for that question.
Yes, so we need that research. I said that earlier, where we need that research, we need that data to inform these policies. Which I can't believe that we come to an end. Oh, this panel, it was so good. This is just the first of many. This is
Right,
just the
we
first
have
of
to
many.
keep this going. We have to keep this going
I
because
know.
we have to have the conversation so that folks understand the importance of changing the way we eat, what we drink, and think about. I'm constantly talking to my daughter like, no Takis for my
Oh
grandchildren.
my God.
You know what I'm saying? Like, I don't
Poison.
care what, you know what I'm saying? To look at the labeling, I'm like, that app, and someone else shared another app, is important because it also shares with us what's the next option on something to use. Like, I like Shea Moisture, but I'm sorry, I'm going to Napoli Naturals in my community that has their apothecary Black owned. I'm gonna go and shop with them, shop with Zaresh online. They're out your way somewhere, I think more like North Carolina. But I'm going to go with people who are using some more natural products. As I looked at Vaseline, me and my friend were in our cabinets throwing out stuff. I was like, what? Grandmama use Vaseline every day, or, Noxzema, those different things. But it's critical because we are the largest consumers, that we have a better understanding what we're paying for, because we're getting what we're paying for in the wrong way. So I'm glad, we're able to have this conversation. So we need like a 2.2, a 4.0.
Let's do it. This is just step one. Listen, this is day one on this historic day. Remember, this is the first time that we had this day. So this is the first of many. So with that, I do want to honor each of you with just one, and again, this is just the first of many to close us out. So I would be remiss not to uplift that with my White House seat. Even though I'm still 25, I'm the youngest African American woman appointed to this council. So I'm still, I still have babies, pretty much. And so a part of this White House council, I've been pushing for 3 years, y'all, for them to put these birth outcomes into this work. If we want to talk about we could talk about investment, in infrastructure. We could talk about, all these investments in climate. But the bottom line is life is human life. If we can, spend as much money in the world, but if more Black mamas are dying, more Black babies are not even making it, then all of that was done in vain. So as with parting words, this is part one. Starting with Almeda, to close us out, and then we'll go to the next panelist. If you had a seat at the table with President Biden and Vice President Harris, where they did this wonderful proclamation last year for Black Maternal Health Week. I'm sure they'll do it again this year, and that's real cute. What would you say? Like, what would be one thing that you would say that they need to prioritize?
One of the things I think is really important is access to information for people on the front line, so to speak. We have helplines at Thanksgiving so you can find out how to fix a turkey. we need a helpline where any woman can call and get accurate professional information with any questions she might have during her pregnancy or that 1 year after, which is also a danger period, in order to be able to get information. And that's just something I've been thinking about, like how to make information accessible quickly and easily. And I think if there were a national helpline where a pregnant woman could call and get a question answered by a knowledgeable person, that would be a huge step forward. And it wouldn't cost that much money. It'd be easy for people to use.
I love that. And you know what? It makes me think about, back to the mental health component. We have like a suicide hotline. We have
Yeah.
things, around mental health.
Right.
That's genius. Anna, what would you say if we had to sit down?
I'm going to be selfish and say to them that we need to make sure that doulas are accessible to all birthing folks in this country. And I'm saying birthing folks because not everybody identifies the same way. But if there's a baby that is possible in your body and coming out of your body, we need to make sure that people are accessing that support. Even if you're having problems, there needs to be some support there as well. And that will cost money, but we can fund wars and all types of different things that don't have nothing to do with us, or we putting our nose in stuff. We can put our nose in our own business and do our own laundry first by making sure that doulas are accessible, and that these doula organizations are resourced to be able to have the intersectionality as far as training and preparing our doulas to be able to stand on the front lines, because we're here and we're doing it anyway. We need to be resourced so that we can continue to do our work. And I personally believe that we are our own rescue. We know what we need. We know how to address each other and ourselves within our community. And we just need that resource. We need that check to make sure that we can do what we need to do. And we're owed at least that.
Right. They owe us. Come on, reparations. In the state of Tennessee, they voting where we can't even say the word reparations. But I know, right? That's another conversation for another day. Dr. James Todd.
So I think, thank you both, because I am going to build on that and would say that such a hotline does exist. It's just super underfunded. So the Pediatric Environmental Health Specialties Units are funded by our federal government. And so the fact that most people don't know that exists, that resource exists, it is a free hotline, if you will, that your doctor can call, you can call if you have any issues or challenges. So being able to better fund that and to build in doulas into that resource. Right now, there are nurses staffed to answer questions around environmental health, and MD physicians, but being able to build in doulas into that and really provide the type of funding that is needed, that will hopefully really help educate the pregnant person, but importantly also the people that are taking care of them, so that they also know how to best counsel and get the care. So right now those resources are very much underfunded. So being able to provide the funding that's needed to support that work.
All right, Lucretia, and then we'll end with Audra.
All right, so I would say, and I sort of alluded to this earlier, that part of our work has to do with fighting for policy level change, but in the meantime, we know we have to meet needs. So I would say until they fix their broken system that doesn't know how to treat us, then give me some funding for some Black birthing centers in cities and in rural areas. So you work on your stuff. Let us get ourselves together over here, because I can't trust you to fix a system for me when you built the whole system against me. So my granddad used to always say, if they didn't treat you right, why do you think they would teach you right? Right. So I want to have hope in the idea that, they're going to respect us and love us and value us, but history has shown that that's not the case. And so I would say funding for centers that would support our health and well-being that have these pieces that everyone else has already talked about in it.
And I think I missed Miss Almeida. My apologies.
No, I went
So
first.
Miss,
You started us off.
you went
I
first?
started us
Okay,
off.
okay. Be
Okay,
sure.
that was
All right, I'm
me.
like, I missed it. Ajua.
You know, I guess I get so frustrated when I hear people talk about the erasure of our history. Because to me, if you have to erase our history, then you have to erase all American history. It wouldn't even be, it wouldn't even make sense to not add in the piece because we built so much. Our ancestors created so much here and for this nation and for the benefit of others that are still being put into play. I think of Dr. Ralph Bunche and plasma, but blood plasma, right? I had to grow up learning that. But if I were in the seat with them, I would want to talk about bills like SB 464, which is the Pregnancy and Dignity in Childbirth Act, that should be nationwide. No doubt, because it also requires not only the maternal mortality review, but it requires education and training on racism and bias from the front office to the back. Now, thankfully, we have an attorney general that is making that law a requirement, and we're addressing that in dealing with clinics across the nation, making sure in hospitals that is being done, following it up with a bill, AB 2319, which just passed, I believe, the Health Review Committee and on its way to appropriation. So not just that, but those laws that are put into play and that are followed up to ensure that they are actually enacted and make sense for us to reduce this incidence of death and disease that is preventable. And finally, the federal omnibus. I mean, passing that. Why are we taking so long to pass the federal omnibus, which really covers, encompasses a lot of what we're talking about here today? And so those would be the things I would sit at the table about. Like, we don't need to keep having meetings about what is happening. The meetings are not, they're counterproductive to preventing death and sickness and disease. Look at what the cost is associated to caring for folks when you could have done intervention and preventive care ahead of time. So thank you so much.
Yes, my heart is just so full of joy this evening. And just for us to come to this moment, for folks, from the work that you all do to bring this to a head where Black women have been screaming, hello to our mothers of the reproductive justice movement, have been talking about this for decades. And I am just so honored to be in this space with you all this evening. Again, this is one of many. You said this was 1.0. We got to keep going to 2.0, 3.0 until we truly get to a place of justice and restorative justice of our wombs, to protect our babies, to protect our mamas. But thank you all so much. Thank you to all of those who were in attendance this evening, and many peace and blessings as we keep fighting the good work and getting into some good trouble. All right. Thank y'all.
Thank you. Thanks so
Thank
much.
you. So
Thank
wonderful
you
to
so
be with
much.
all of you.
Yes,
Thanks for
same,
having me. Glad to
same.
be here.
We'll see
Okay.
you.
All right, you all take good care.
All right. Bye-bye.